Good evening, I am Chelsea Jones, and I will act as the compliance analyst as we discuss this medication administration error that happened at our hospital. So, we will discuss first the legal elements of negligence, and that includes duty of care, breach of duty, causation, and damages. So, the duty of care was the nurse to administer the medication to the patient. So, of course, this happened. And the breach of duty was the wrong medication being administered. Because the wrong medication was administered, there were adverse effects, and there is proof of that. The damages include pain and suffering and an extended hospital stay. The standard of care includes the nurse administering medication possibly 3 to 2 times a day. The patient getting this medication, that doesn't mean they got it all 3 times, but in this one instant, they got the wrong medication. And the proof shows that this could be done due to the nurse being negligent or due to the pharmacist mislabeling or placing the wrong medication in the wrong packaging. So we would first like to talk about how could this have possibly happened. This could be due to fatigue, due to low staffing, nurse-to-patient ratios, or even lack of training. As a nurse myself, I can see how nurses scan patients, then they also scan barcodes. So a computer or a computer system can prompt and flag that this is the wrong medication for this patient. There can be a system issue if that didn't do that. Or a nurse moving so fast and needing more training could just omit and not read that prompt. So we can examine how the hospital can go through with having additional training to ensure that nurses or staffing do not omit that. We can also ensure that the correct medication is in the correct packaging, even if the medication is wrong, expired, or incorrect. We can also prompt for Omnicells or medication dispensing machines to administer the correct medication, or that medication can be scanned or in the correct place before they are given to avoid instances as these. Like I spoke of fatigue, we can ensure that nurses do not work more than 5 days in a row to stop these problems from happening. Because these problems happen, and we can stop that from happening by making sure nurses do not work as many days in a row. Or also intensifying and prompting training. I also like to talk about how nurses can be deemed negligent simply just from being tired. Adverse effects can be so severe, and that is our proof of the damages that were done. We can explore the possible legal consequences from the nurse or the hospital or the patient. So there can be termination, there can be loss of licenses, there could be loss of accreditation for hospitals. It can just look terrible for the reputation of the entity or the institution. Whether you succeed or the lawsuit or else, word of mouth, it can be a lot for a reputation and credibility of an institution. One can improve staffing, one can enhance medication verification process, barcoding, sign off with 2 patient identifiers, and have 2 nurses at the bedside. Having verbal communication, letting the patient know what medication they are given, so they can know, oh no, I don't take that, or no, they didn't look like the pill I usually take. So these things can be avoided, and hopefully with better staffing ratios and better education, this will not happen again. Thank you.